Have you been struggling with shoulder pain? Went to your doctor to only be told that your shoulder's fine, there's nothing wrong? You might be suffering from frozen shoulder. Hi, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health. And we see this often in our clinic. Patients that have chronic shoulder pain, and they've been told, the images look fine. There's nothing showing up on the images that would indicate there's any problem at all. But they're not fine.
No, they're not. What tends to happen with frozen shoulder is it can look fine. You can't see this capsule that surrounds that whole joint on the film that they normally try to diagnose shoulder issues with.
It just doesn't show up on the x-ray.
Exactly. And so what happens is that capsule over time starts getting thicker, and then they can't brush their hair, they can't scratch their back, they have troubles adjusting their rear view mirror, and they keep getting told their shoulder's fine. They just need to stretch it more.
Yep. They just start losing the range of motion, and it's usually gradual. Yeah. So it's a gradual onset, and they lose this over a period of time. Some people 3-4 years.
Yeah, if they don't get it checked out sooner, they'll go on with pain for 3 to 4 years, and even longer than that if they don't ever get it fixed. But what we have to do is figure out that it is frozen shoulder, and how we do that is through thorough examination. Orthopedic exams can tell us, what tissues are involved in and what's happening with that shoulder, sometimes when imaging can't.
You bet. Just by putting the shoulder through a series of orthopedic tests, you're going to find that capsule has adhered to some of the tissues. So what do you do to correct some of those findings?
Right. So when you find that thickened capsule and those shortened ligaments and tightened muscles, chiropractic adjustments are huge. Resetting the joint capsule itself, as well as some soft tissue work that we're highly trained and effective in doing and loosening up those many different tissues that have tightened in that shoulder over time. Now the important thing with this is getting it done quickly and in a period when you start to notice that pain, rather than waiting for it to become a huge deal to where those...
That's true with most health conditions. People tend to
absolutely.
put them off, right? They push it off, and unfortunately it creates a bigger problem. And I think the thing I want to kind of come back to is chiropractic adjustments for the shoulder. Most people think about this for the spine and adjusting vertebra, but we don't really think about like these extremities, like a shoulder joint, an elbow joint. So the adjustments on the shoulder actually can remove the adhesions in the capsule.
Absolutely. And that's exactly what's causing this, is adhesive capsulitis. That's the other term for frozen shoulder. If we can remove those adhesions, if we can get that shoulder moving, what more can our patients do with their arms? They can brush their hair now. We've seen this happen even after patients have had surgeries. They go through physical therapy, they get some motion back, but then because that arm still hurts them, they hold it still, and then it freezes again. So even after surgery, sometimes it takes a little extra to get the mobility back.
So if you think you're struggling with shoulder pain, possibly even like a frozen shoulder, adhesive capsulitis, then give us a call. We'll be glad to check it out and see if it's something that we can help with. And remember to like, share, and subscribe below.